Sample size determination is the act of choosing the number of observations or replicates to include in a statistical sample. For that matter, the sample size of a study pertains to the number of participants selected from the population to be included in your sample. So whenever we would submit a research proposal to a technical board for review, you as a researcher are expected to provide an estimated number of study participants you might need for a particular research study. In order to be able to make that estimation, we should at least know the basic ways of determining sample size. As we will be discussing more in a bit, it is important as well that you are familiar with the kind of research design you have for your project, since how sample size will be determined is dependent on the study design being used. Of course, we are not expected to measure the entire population of interest for obvious reasons of practicality and feasibility. Instead, we can draw a sample from that population, provided everyone in that population has an equal chance of being included in the study. The selection of one participant should not affect the chance of another selection, which means that the selection was made randomly and independently. And the sample that was drawn has to be representative of the population of interest. Now, why do we need to compute for sample size? The sample size is computed beforehand for purposes of planning, so that bias in the interpretation of the results can be kept to a minimum. We also need to compute the appropriate sample size so that our study becomes sufficiently powered. Now, by having sufficient statistical power, we mean that because you are able to include an adequate number of study participants, your study now has the ability to detect a difference or an effect if there is indeed a difference or effect in the population you are generalizing to. Stated differently, if your study has sufficient power, it is sensitive enough to pick up or detect the difference that is indeed present. Finally, we need to know the sample size beforehand so that we can be able to minimize sampling error, which would in effect generate more meaningful results. As I just mentioned previously, you need to get a sample of sufficient size so that your study has the desired power. Now, if you only recruit a few participants in your study, below the desired computed sample size that is, chances are your study becomes underpowered. And because of that, the results you obtain cannot be generalized to the population you would like to make inferences on. On the other hand, it may not necessarily be a good thing either if you've included too many participants in your sample. For one thing, particularly in clinical trials, you may actually be putting more individuals at risk for adverse effects of an investigational intervention or drug. Also, more study participants beyond what is needed mean more resources wasted. This graph illustrates how more does not necessarily mean better. As you can see here in this graph, the greatest gains in precision can be obtained when you increase your total sample size by up to, say, 500. Those gains begin to plateau beyond the 500 mark. Now, to be able to gain further precision by decreasing the maximum margin of error by 1.3 points from that point onward, the sample size has to be doubled to 1000. However, if one wishes to further decrease this margin of error by another 1.3 points, the total sample size has to be increased to 2800. Now, unless your study protocol demands the narrowest margin of error as possible, and you have the funding and resources to do it, then getting such a large sample size may not be feasible at all. Now, bear in mind, however, that there are quite a number of clinical trials that have sample sizes as high as 10,000s. This is all really protocol and objective driven. A seemingly statistically small difference in effect between control and intervention groups may actually be clinically significant, that in order to detect such a small difference, a very large sample size is needed. There are a number of factors on which sample size is dependent. The first is the level of significance, or alpha, that is considered acceptable by the researchers. In clinical research, we almost always default to an alpha of 0.05, which corresponds to a confidence level of 95%. Bottom line is, the smaller your alpha, or correspondingly, the higher your confidence level, the larger the sample size you'll need. Now, the sample size is also dependent on the estimated effect size. To put it simply, the effect size is the difference between the value of the outcome variable in the control group and in the test group. The effect size is generally based on previous research or data from pilot or preclinical studies. It could also be an estimated guess if no prior data is available. Basically, the larger this difference is between control and test group, the smaller the sample size you'll need, and vice versa. The sample size is also dependent on the desired power of the study. As I mentioned earlier, statistical power is how sensitive your study is in picking up a difference or effect that is indeed present. Thus, the higher the desired power is, the larger the sample size you will need. In clinical research, power is typically set at least 80%. Now, the underlying event rate in the population, or simply the prevalence rate, also dictates how large the sample size will be. This prevalence rate is not set by the researcher, but rather is estimated from previously reported studies. Basically, if the event rate or prevalence rate is low, you will need a larger sample size to be able to derive any meaningful results from your study. Finally, sample size is dependent on the standard deviation of the measure you're trying to estimate in the population. Standard deviation, like the variance, measures how dispersed or deviated the values are from a given mean or average. Just like the prevalence rate, the standard deviation is also estimated from previous data. Basically, if a standard deviation is large, a larger sample size is needed, especially when you're dealing with detecting a difference between two study groups. By the way, they call that standard deviation is the square root of the variance. Now, when you're trying to determine sample size, there are a few things that you need to know first about your study, since how you are going to compute for the sample size will depend heavily on this information. First, is your study descriptive or analytic? Does your study have a cross-sectional, cohort, case control, or randomized control design? What is your primary outcome variable, and how different do you expect this outcome to be between control and test groups? Now, this piece of information is important in estimating the effect size that I mentioned earlier. If your study is a descriptive survey, are you interested in estimating a proportion or a mean value in the population you are trying to generalize your study to? Now, what is the standard deviation of your variable of interest? And is this deviation clinically important? What is your desired confidence level and power? And lastly, is your hypothesis one-tailed or two-tailed? If your hypothesis is one-tailed, it means that you are hypothesizing that the mean or proportion is either greater or less than a certain value, but not both. In other words, given a certain intervention, let's say an investigational antibiotic for instance, you are at best expecting the average cure rates to be greater than the control group. If your intervention is, say, an investigational pain reliever, you are at best expecting the average pain scale to be lower than the control group. On the other hand, if you are allowing the possibility that the direction of a certain effect can go either direction, then your hypothesis is said to be two-tailed. Hopefully, in the following examples that I will give, this concept of having one-tailed or two-tailed hypothesis will become clearer. Let's start off with something simple as far as sample size estimation goes. Let's first look at the sample size requirement for qualitative studies. Now, as a review, qualitative studies are performed when you seek to explain, explore, or understand a particular phenomenon. It makes use of more flexible designs and less structured methods such as interviews, focus group discussions, observations, and content analyses. Qualitative studies allow open-ended questions, and data is generally provided as a narrative. Now, for qualitative studies, the sample size requirement is typically smaller than that of their quantitative counterparts. On average, about 30 to 50 participants or interviewees are needed. However, the number of participants needed depends on whether or not the so-called point of data saturation is reached. But how do we know when we've already reached this point? Saturation occurs when adding more participants to your study does not result in additional perspectives or information coming from those being surveyed or interviewed. Like when you regularly encounter the same themes in a participant's responses, perhaps adding more participants may no longer be needed. We then look into computing the sample size requirement for descriptive cross-sectional studies. As a review, such studies simply characterize the prevalence of a disease, characteristic, or health outcome in a specified population at one point in time. No inferences about associations or relationships between variables are being made with descriptive cross-sectional studies. Structured surveys are typically employed when carrying out these type of studies. You'll have descriptive cross-sectional studies with a general objective of either estimating the mean of a continuous variable in a population or estimating the proportion of a characteristic in a population. I will be giving you examples of this in a few moments. But first, I would like you to access this website, which contains calculators for computing the required sample sizes given the above two scenarios. The first scenario is estimating the sample size requirement of a cross-sectional study that aims to estimate the population mean. As part of their efforts to improve the quality of service to their patients, a hospital director and his staff have decided that one of their goals should be to shorten the waiting time of patients in the OPD. After studying all available information, it was agreed that they should aim for a mean waiting time of less than 25 minutes with a standard deviation of 2 minutes. They then started implementing the proposed improvements in patient services. A month later, the hospital director wanted to know if their efforts have paid off by conducting a service quality survey. Additionally, he is also entertaining the possibility that the implementations are a failure and might have actually lengthened the waiting time. What would the required sample size be if it desires a margin of error of 0.5 minutes and a confidence level of 95%? So the mean being estimated here is mean waiting time of patients in the OPD. The hypothesized mean here is 25 minutes with a standard deviation of 2 minutes. The hospital director also desires a margin of error of 0.5 minutes and a confidence level of 95%. Additionally, he is also entertaining the possibility that the implementations are a failure and might have actually lengthened the waiting time, meaning he is allowing the possibility that the estimated mean waiting time has gone in either direction, thus making his hypothesis two-tailed. Now, when you follow the link that I provided in one of the earlier slides, you will be led to this website here with this web page. Now, I need you to click this button here, Population Mean Sample Size. Now, it will lead you to this page where you find here the calculator for sample size. And we put here the desired margin of error, which is 0.5 minutes. So we keep our confidence level at 95%, as stated in the word problem earlier. Now, we don't have any information as to how big the population is, so we're just going to leave it at 100,000. And it was also given earlier that the standard deviation was 2 minutes. But keep in mind that standard deviation is the square root of variance. What is being asked here is the population variance. So the hypothesized standard deviation is 2, so you have to square that so it becomes 4 in order for the standard deviation to become the variance. So you put here 4, and your recommended sample size or your sample size requirement is 62. Here's a similar scenario. You're interested in the particular small province where prevalence of a certain type of gastric carcinoma is significantly higher compared to the general population. You hypothesize that a certain enzyme marker is strongly associated with this type of gastric cancer, but since you don't have any information about it yet among the residents in that province, you decided to first embark on a prevalence study to find out the mean activity level of that enzyme marker in that locality. The only information you have about this marker is from earlier general population studies, which estimated the mean activity level to be 0.718 with a standard deviation of 0.511. From the latest census, you determine the population of that province to be 30,000. What would the required sample size be if you desire a margin of error of 0.001 and a confidence level of 99%? Now, the mean that this descriptive cross-sectional study is aiming to estimate is the mean enzyme marker activity level. Now, from prior literature, the population mean was noted to be 0.718 with a standard deviation of 0.511. The desired margin of error is 0.001 and the desired confidence level is 99%. Since the researcher has no information whatsoever about the mean enzyme marker activity of a population of interest, it is possible that his study could reveal a mean value that could be higher or lower than the population mean of 0.718. Thus, this is two-tailed. Additionally, we have information about the size of the population of interest. Now, let's go back to the same website as earlier, and again click this button here, Population Mean Sample Size. Now let's input the necessary information here in the calculator. So the desired margin of error is 0.001, confidence level is 99%, We have knowledge about the size of population, so it's 30,000. And the population variance is what we need, but what we have is the standard deviation of 0.511. So squaring that would give us 0.261. Now the desired sample size would then be 29,490. Well, this could be because the standard of the margin of error that you desire is actually quite narrow, and you have a very high confidence level desired. Let us now look into a scenario wherein the descriptive cross-sectional study aims to estimate the population proportion of a particular medical condition. A researcher wants to estimate the prevalence of gestational diabetes mellitus or GDM. What is the sample size if it is expected that the prevalence of GDM is 2.5% and a 95% confidence level will be used with a margin of error of 1%? Here, the researcher aims to estimate the prevalence of GDM in the population of pregnant women. Recall that one of the things that influences sample size is a population prevalence rate, which is basically the same as a population proportion in this case. Thus, one of the important pieces of information that we will need is a hypothesized prevalence of 2.5%, as stated in the scenario. Other important information contained within are the confidence level of 95% and a margin of error of 1%. Since there is no mention of the researcher expecting the estimated proportion to be higher or lower than the hypothesized proportion, the hypothesis is two-tailed. So we use the same website from earlier, but this time we click on the button Population Proportion Sample Size. So that leads us to the page where we have the calculator. So as stated in the scenario, the desired margin of error is 1%. Our desired confidence level is 95%. Now, we don't have any idea of how big the population of pregnant women are, so in this case, we'll just leave it at 100,000. And the estimated proportion of GDM is 2.5%. That yields an estimated sample size requirement of 928. Now we move on to sample size determination for analytical cross-sectional studies. Recall that the hallmark of analytic studies is the presence of a comparison group, because it is in analytic studies where we assess the relationship or association between variables such as exposure and health outcome, and we want to know if the odds of getting the outcome differs between those in the exposed group and those in the unexposed group. Particularly in analytic cross-sectional studies, since we are measuring both exposure and outcome in only one point in time simultaneously, we will end up with four types of study participants, namely those with neither exposure nor outcome, those without exposure but with outcome, those with exposure but without outcome, and those with both exposure and outcome. Let us look at a particular scenario. You as a researcher would like to know if the length of breastfeeding period during infancy is associated with a decreased risk of childhood obesity. Basically, you would like to find out if an association exists between exposure and outcome. Exposure here is the length of the breastfeeding period during infancy, and the outcome is childhood obesity. Now, basing on literature review, you dichotomize the exposure to length of less than 7 months and length of 7 months and up. For the outcome variable, it is either the study participant has childhood obesity or not. With that, you can classify your sample into 4 categories as follows. In order to be able to arrive at the appropriate sample size requirement, you need knowledge on the prevalence of each in a general population, from which you will be randomly selecting your study participants to make up your study sample. You would also need to decide on a confidence level and a margin of error. Now, the reality of research is oftentimes you do not have the needed information on prevalence. More often, you will just have to settle with using the overall prevalence rate for the exposure or the overall prevalence rate for the outcome. Or you can make an educated guess or come up with a hypothesized prevalence rate. Now, for the sake of exercise, let us just say that we have indeed found the prevalence rate of mothers breastfeeding their infants for a period of 7 months or longer, and the most up-to-date prevalence rate of childhood obesity in the Philippines. You also decided on 95% confidence level and a margin of error of 2.5%. Okay, now for this particular scenario, we again use this website, selectstatistics.co.uk, and then we select this button here, population proportion sample size. So now we have the calculator again. The information that we have gathered from the scenario is that our desired confidence level is 95%, our desired margin of error is 2.5%, and we actually have two prevalences. So the first is the exposure prevalence, which is 7.4%, and the outcome prevalence, which is 13.5%. Now, we basically don't have any information about the size of the population. So again, we'll just leave it at 100,000. So let's start first with inputting the first prevalence, which is the exposure prevalence. So it's 7.4. So that yields a recommended sample size requirement of 420. So let's look now at the other prevalence, which is the outcome of prevalence. So that's 13.5%, and that yields us with 713. So the rule is whichever is the larger sample size, that's the sample size that we'll be going for. Let us now talk about sample size requirement for case-control studies. Case-control studies are also analytic studies in that you would like to determine if an association exists between exposure and outcome or disease. Likewise, you would like to know if the odds for the outcome differs between the exposed group and the unexposed group. Now, as a review, in case-control studies, you begin by selecting subjects based on the presence or absence of disease. That is, you determine your cases and your controls. You then review the records to see who among each group had the exposure and who did not. When determining the sample size for case-control studies, you will need the following information: your desired confidence level, your desired power, your desired case-to-control ratio, the proportion of controls with exposure, and the proportion of cases with exposure. Once you have all of these, proceed to the OpenEpi web page. Let us look at an example scenario for case control. A researcher wants to determine the association of physical activity and myocardial infarction. This researcher plans to recruit patients who had MI for the first time and compare them with patients who never had MI. How many patients should be included in the study if desired confidence level is 95% and desired power is 80%? A previous well-designed, well-conducted study reported that among MI patients, 30% were rated to have high physical activity, while among non-MI patients, 50% were rated to have high physical activity. So in this scenario, the outcome of interest is myocardial infarction or MI, and the exposure of interest is physical activity or PA. We have information on the desired confidence level and power, and we also have information on proportion of cases with exposure, as well as the proportion of controls with exposure. Since there's no mention of the desired case-to-control ratio, we will just assume a 1-to-1 ratio. With all this information at hand, let us now proceed to the OpenEpi website. Okay, so we're going to use the OpenEpi website to compute for the sample size requirement for the case control scenario. So to begin, let's hover the mouse over the sample size option. So click on that, and it will show a drop-down menu, and you select Unmatched CC. So CC here stands for case control. So once you select that, a new tab will open, and once it does that, click Enter New Data. So the desired confidence level is 95%, so we're just going to assume the two-sided confidence level. Our power or desired power is 80%, and since there's no mention on which case-to-control ratio to use, we're just going to assume the 1-to-1 ratio or 1.0. Now, per the scenario, the percent of controls who have the exposure is 50%, and the percent of cases with the exposure is 30%. And that computes for us automatically an odds ratio. So once you've got all of the information here, you click Calculate. Now you'll see that there is a corresponding sample size requirement for both cases and controls. So for cases, we need 104 cases included in our study. We need 104 controls as well. And our total sample size requirement basically is 208. So by the way, we're going to use the flies with correction or continued correction sample size here for OpenEpi. Let us now tackle sample size computation for cohort studies. Just as with analytic cross-sectional studies and case control studies, you would like to determine if an association exists between exposure and outcome, or disease for that matter. This time, however, you start off with a population or a group of study participants, which you'll call your cohort, that satisfy the inclusion criteria for your study and are outcome or disease free. A portion of them will have the exposure of interest and the rest will not. Keep in mind that cohort studies are observational, not interventional, and thus study participants are not randomly allocated to either getting the exposure or not getting the exposure. And because there is no randomization, The number of exposed and unexposed individuals will be unequal or unbalanced. You follow your cohort over time, and you note who among the exposed group and unexposed group developed the outcome or disease of interest. With cohort studies, you basically would like to know if the risk for getting the outcome differs between the exposed group and the unexposed group. When determining the sample size for cohort studies, you will need the following information: your desired confidence level, your desired power, your desired unexposed to exposed ratio. Now, here we're just going to default to 1:1 since we already know that because of the lack of randomization, the number of exposed and unexposed participants will most likely be unequal or unbalanced, and there's no way of knowing what the actual ratio will be beforehand. Next, you will need the proportion of the unexposed with the outcome, which you will derive from prior studies, and you also need the proportion of the exposed with the outcome, which you will also need to find from literature. Now, once you have all of these information, proceed to the OpenEpi webpage. Time for another scenario. A researcher wants to determine the relationship of infant feeding with school performance. You follow a cohort of infants from the time they were born all the way to the time they attended kindergarten to see if initiation of bottle feeding during the first 3 months of life increased the risk of having below average performance in kindergarten. A previous study reported that 50% of children who remained purely breastfed until the third month of life performed above average in kindergarten, while 25% of children who started bottle feeding during the first 3 months of life performed above average. How many children who were bottle fed and not bottle fed during the first 3 months of life should be included in the study if the researcher wants to set confidence level at 95% and power at 80%? Now, in this scenario, the researcher hypothesized that exposure of infants to bottle feeding during the first 3 months of life increases the risk of having below average performance in kindergarten. The exposure of interest here is bottle feeding during the first 3 months of life, while the outcome of interest is occurrence of below average performance in kindergarten. The information we have available here is a desired confidence interval and desired power, and we can derive information on proportion of exposed and unexposed children with the outcome from the scenario as well. Now that we have all this information, let's proceed to the OpenEpi website. Okay, now we want to compute the sample size requirement for a cohort study. So we do the same thing as previous here in the OpenEpi website. So we click sample size, so that produces a drop-down menu. So we click on cohort/RCT. So in doing so, we actually open a new tab, and once it's finished loading, we click enter new data. All right, so again, we assume two-sided confidence level, and we chose 95% for our confidence level. So, and our power is at 80%. So we just assume that the ratio between exposed and unexposed is 1. So we maintain the ratio at 1.0. Now, per the scenario, says that 50% of infants who are purely breastfed during the first 3 months of life performed above average in kindergarten. So basically, those who are unexposed to bottle feeding during the first 3 months of life, 50% performed above average in kindergarten, while the other 50% performed below average, I would assume. So we put here 50. Then next we click here in this part here, percent of exposed with outcome. So according to the scenario, those who actually had bottle feeding during the first 3 months of life, 25% of them performed above average in kindergarten. So that means 75% of them performed below average. So once you've inputted all that information, so basically all the other parameters here will compute accordingly, or will provide a computed value. So now that we've filled out all the information here, let's click calculate. All right, so now we will need 66 infants who were exposed to bottle feeding during the first 3 months of life, and 66 infants who were purely breastfed. So that brings us to a total sample size of 132. Again, we choose the flies with continuity correction column here for our sample size. The next order of business is determining the sample size for randomized controlled trials, or RCTs. Now, as a review, RCTs are experimental analytic studies in that the researcher has control over the amount or dosage of exposure being given to the study participants. RCTs are similar to cohort studies in that study participants are followed over time following exposure to see if the outcome of interest has been attained. However, unlike cohort studies, RCTs have the component of randomization of study participants to either control group or treatment group. Randomization minimizes the differences among groups by equally distributing the participants with particular characteristics among all the trial arms. The researchers do not know which treatment is better. With randomization, there is an equal or near equal number of participants per group. The information you will need in determining the sample size for RCTs is pretty much the same as with cohort studies, except that you may need to specify the unexposed to exposed ratio. It is typically 1:1, but sometimes a 2:1 ratio is used. Whenever you're going to use such a ratio, you must provide a good rationale for doing so. Also, which method of sample size computation you will use will depend on the kind of variable your outcome is. If your outcome of interest is dichotomous, meaning either you have the outcome or you don't, then you must provide the proportion of the unexposed with the outcome and the proportion of the exposed with the outcome. On the other hand, if your outcome variable is continuous, you must provide information on the mean and standard deviation of that outcome for both trial arms. Now, once you have all of these information, proceed to the OpenEpi web page. Here is an RCT scenario where your outcome of interest is cure. The outcome variable is dichotomous in that the study participant either attains the cure or not, and dichotomous outcomes are generally reported as proportions or percentages. You want to test a new drug in its ability to cure disease A. Compared to the current standard of care, you hypothesize that with this drug, the cure rate is 5% higher. The current cure rate of disease A using standard of care, according to current literature, is 80%. Now, with 95% confidence level and a desired power of 80%, what is your sample size requirement? Now, assume a 1:1 randomization. So, here you have a confidence level of 95%, an 80% desired power, and you're assuming a 1:1 randomization between control and treatment arms. Now, according to the literature, the cure rate of disease A using the current standard of care is 80%. Now, with the new medication, you hypothesize that the cure rate will be 85% or 5% higher than the current cure rate. Now that you have all this information, let's proceed to the OpenEpi website. Okay, so here we are again in the OpenEpi website. So recall from the scenario that our outcome variable is dichotomous, meaning either you have the outcome or you don't. So with that, again, we click sample size, and then we click this part of the drop-down menu, cohort/RCT. Okay, so another tab will open, and once that is finished loading, we click enter new data. So our desired confidence level is 95%, so our power is 80%. So we assume a 1:1 randomization between treatment and control arm. So and then the percent of unexposed with outcome, as mentioned in scenario, is 80%. And you want to test a new drug. So basically, the new drug is basically the exposure here, and you expect or hypothesize a 5% higher cure rate after treatment with a new drug. So once you click the other parts of this table here, everything will compute automatically. So now that all the information is complete, we click calculate. So for that, we will need a total of 2,096 study participants. That is 1,048 participants for each trial arm. So again, just to reiterate, we're going to use the column here for flies with continuity correction. Here is another RCT scenario where your outcome of interest, hemoglobin level, is a continuous variable. You want to compare the effect of two anti-anemia drugs on hemoglobin levels. What is the sample size needed if the expected mean hemoglobin level after treatment with drug A is 13.27 grams per deciliter with a standard deviation of 1.53, and the mean hemoglobin level with drug B is 12.74 grams per deciliter with a standard deviation of 1.82. Assume a confidence level of 95%, an 80% desired power, and a 1:1 random allocation between treatment arms. So, as with the previous RCT scenario, we have the same information and confidence level, power, and randomization ratio. This time, however, since the outcome of interest is continuous, you provide the expected or hypothesized mean hemoglobin levels and their respective standard deviations for both treatment arms. With all this information at hand, let us now proceed to the OpenEpi website. Okay, now for this particular RCT scenario, our outcome variable is a continuous type. So because our outcome variable is hemoglobin levels. So for that matter, we're not going to use the same option as we did earlier with the scenario with the dichotomous outcome variable. So again, let's click sample size here. But this time we click this one here. We choose this one, mean difference. So it's going to open up a new tab. So once that is finished loading, we click enter new data. Okay, so our confidence level and power remains the same at 95 and 80% respectively. So again, we assume a 1-to-1 randomization ratio. So with group 1, the group being treated with drug A, the mean hemoglobin levels would be 13.27 with a standard deviation of 1.53. Okay, so just be careful here. You do not enter this value under variance. Well, technically you can, but you have to square this value because variance is standard deviation squared. And reflexively, standard deviation is the square root of variance. Okay, now for the other arm, the group being treated with drug B, the mean hemoglobin levels would be 12.74 grams per deciliter with a standard deviation of 1.82. Okay, right. So now that we've got, you don't worry about filling out the rest of the table here. This is all the information that we need. Now that we have all of these, let's click calculate. All right. So our total sample size requirement would be 316. That is 158 study participants for each treatment arm. Next on the list is determining the needed sample size for diagnostic accuracy studies. Now, basically, diagnostic accuracy studies, sometimes termed as simply diagnostic research, evaluate whether a particular test is able to discriminate between the presence and absence of a particular disease as determined by a reference or gold standard. Now, to put it loosely, diagnostic studies aim to determine the predictive value of a test under investigation. Now, in addition to sensitivity and specificity, such studies also determine other measures, namely positive and negative predictive values, likelihood ratios for a positive or negative test result, and the area under the receiver operator characteristic curve or ROC curve. Now, diagnostic studies are often conducted in a patient population selected on disease status and non-diseased controls. For that matter, sample size is computed using sensitivity and specificity, as I will show in a bit. Now, very briefly, diagnostic research is particularly useful when you want to know if a new screening test would have better diagnostic accuracy than the old one. Generally, you want the new triage test to have a higher sensitivity than the current standard screening test being used. Now, similarly, diagnostic research is also useful if you want to know if a replacement diagnostic test performs better than an older diagnostic test. In this case, you generally would want the replacement diagnostic test to have better specificity. Now, lastly, you can also evaluate an add-on diagnostic test using diagnostic research for purposes of subclassifying disease, for instance, or to get a more accurate diagnosis. Now, as with replacement diagnostic tests, you would want the new add-on test to also have better specificity. The information you will need when determining sample size requirement for diagnostic accuracy studies are, of course, the desired confidence level and power. You will also need the prevalence of the disease that the diagnostic test is supposed to diagnose. And lastly, you'll need the documented sensitivity and specificity of the old test we are aiming to replace with a new one, or alternatively, the hypothesized sensitivity and specificity of the novel test if it's the first of its kind. We always presume that the older test has lower sensitivity and or specificity than the proposed new one. And whenever available, we make use of the sensitivity and specificity of the old test. Now, the lower the sensitivity and or specificity, the higher the sample size requirement, which we actually prefer with diagnostic studies. Now, we'll be using an Excel file to calculate the sample size requirement. Now, this calculator is useful in that it allows you to take disease prevalence and dropout rates into account. Unfortunately, I could no longer retrieve the website where I downloaded this file from, so a copy of it will be provided. Now, let's try determining the sample size requirement in this scenario. You are assessing a new diagnostic test to see if it can replace an old test to diagnose a disease that has a prevalence of 11%. The old test has a sensitivity of 89% and specificity of 92%. You hypothesize that this new test is 5% better in terms of sensitivity and specificity. What should your sample size be, assuming 95% confidence level and 80% power? Now, in this scenario, we are provided with the desired confidence level and power, and we have the sensitivity and specificity measures of the old test. And just as important, we have the prevalence of the disease as well. Okay, so here's the Excel file when you open it. As you'll notice in this calculator, the confidence level and the power are both default at 95% and 80% respectively. So alpha, as you could recall, is the same as your as 1 minus the confidence level. So if you have an alpha of 0.05, that means that your confidence level is 0.95 or 95%. Now, power, on the other hand, is the same as 1 minus beta. So if your beta error is 0.2, that means your power is 0.8 or 80%. Now, the delta here is the so-called margin of accuracy. So in this calculator, it's actually default at 0.1, although some experts would actually recommend putting it at 0.05. So we'll compare the corresponding sample sizes with 0.1 and 0.05 margin of accuracy. Now, according to the scenario, the sensitivity of the old test is 89%, so we'll put that in here. And then the sensitivity of the old test is 0.92, so we'll put that in here as well. And you'll see that it calculates the numbers accordingly. And we don't stop there. Of course, we also have to fill out the prevalence cell here. So according to the scenario, the prevalence rate of the disease that we're trying to diagnose with this test is 11% or 0.11. So we put that in here. Now, most diagnostic tests, or I mean rather, diagnostic tests are generally of the cross-sectional type. So oftentimes, or more often than not, dropout rates are pretty much zero or very minimal. So we'll just leave the dropout rate at 0 and the compliance at 100%. Now, there are some diagnostic studies that are prospective in nature. So, of course, that would mean that you follow these patients over a long period of, a substantial period of time. And during that time period, you cannot avoid the possibility of dropouts. So if that's the case, if you anticipate a dropout rate of, let's say, 10%, you put 0.1 here. So we'll just compare the numbers with and without dropouts as well. Okay. Now, what does this mean here? Yes and no. So the dictum is whichever is the larger sample size, that's what we're going to go for. Because if we choose the smaller sample size, that would mean we're only powering this study for the sensitivity, for the specificity of the test. Now, if we actually go for a larger sample size, we're actually powering the study to cover both sensitivity and specificity of the test we're trying to investigate. So in this case, our total sample size, well, it's rather big. It's 2,737 in this case. Now let's try to compare this with a lower margin of accuracy, let's say 0.1, as per the default settings of this calculator. Okay, all right. So you'll see that the requirement is a lot lower. Okay. Now, what if we actually have a 5% dropout, or rather 10% dropout rate, as I mentioned earlier? So we'll put here 0.1, and of course you have to adjust the compliance accordingly. Here at 0.9. Okay, we do the same here. Okay, and you'll notice that the sample size increases by almost 200, because it's better to actually go to actually recruit more if you're anticipating that 10% of this group would drop out over time. Okay, so let's put this back to 0 and 1. So assuming that we're actually doing a cross-sectional diagnostic study, then I would expect a minimal to 0 dropout rate. So keeping a margin of accuracy of 0.1, then our total sample size requirement, or rather our minimum sample size requirement, would be 800. As a recap, we've covered the different ways of determining sample size depending on your study objectives and study design. They are summarized here in this slide. Now, sample size can also be computed basing on the statistical method you will use. So here's a partial list of typical statistical tests performed in many medical researches, and these statistical methods can be regardless of study design. Now, which statistical method you will use is generally determined during the design phase of your study. There are statistical methods that require a large sample size, such as in the case of regression analyses, where you can have more than one independent variable on top of having potential confounding variables, or multivariate analyses wherein you have more than one dependent or outcome variable. The dictum here is that whichever computation yields the larger sample size, that's the sample size you'll be going for. Like, for instance, you want to conduct a case control study, and one of the statistical methods you'll be performing in your analyses is multiple logistic regression. Now, if the sample size requirement based on multiple logistic regression is larger than the sample size that is yielded if you compute it basing on your study being of the case control design, then we go for the former, which has a larger sample size. Now, such computations basing on statistical method used can be carried out by a program called GPower, which is free to download from this site. If you are statistically savvy, then this is a very useful program for you. Otherwise, it is highly recommended to seek statistical consultation to arrive at the appropriate sample size for your study. Now, the next few slides will be some exercises or practice scenarios for you. Now, read through them, pause the video as needed, and work on them on your own using the appropriate sample size calculator. Now, once you've finished, compare your answers to the answer key to see if you got them correctly.